welcome to Psychology Hour. I'm your host, Robert Thornton, and today we're here with one of the most prominent psych researchers from the UK, Dr. Jasper Cunningham. Dr. Cunningham, thank you so much for being here with us today.
Oh, it is quite splendid. Thank you, sir.
We're here today to talk about body dysmorphic disorder, or BDD, a psychological disorder that has grown significantly in prevalence over the past few decades. Tell us, Dr. Cunningham, when did this disorder become significant?
Well, Robert, BDD was not officially recognized as a disorder until 1987, when it was included in the DSM-3R. Today, it is listed in DSM-4-TR as a type of somatoform disorder. It is defined as a preoccupation with an imagined defect in appearance or disproportionate concern with a slight physical anomaly. The international prevalence of the disorder has not yet been reported with accuracy, but it is said to affect somewhere between 1 and 2% of the general population of the United States, or about 5 million people. It is equally prevalent among women and men, and most often tends to emerge between the ages of 14 and 20.
I see. So, how would a psychiatrist like yourself go about diagnosing the disorder? What kind of symptoms are you looking for in a patient?
One of the challenges in diagnosing this disorder is the fact that many people aren't willing to reveal their concerns over their body image, as troubling as the concerns may be for them. Therefore, many psychologists and psychiatrists alike are convinced that a significant number of cases go unreported. However, there are a variety of common symptoms. According to the DSM-4, the disorder is marked by 3 main criteria. First, preoccupation with an imagined defect in appearance. This can be literally anywhere on the body, but tends to occur most frequently on the upper body and, most often, the head. It could be an issue of symmetry, of proportion, or of anything the person generally finds unattractive and conspicuous. This leads to excessive examination in mirrors and also can lead to frequent medical visits. If a slight physical anomaly is present, the person's concern is likely to be particularly excessive. Second, the preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Is this distress causing them to miss work or perform poorly on an otherwise simple task, etc.? And finally, the preoccupation cannot be better accounted for by another mental disorder, such as anorexia nervosa or OCD, among others.
Intriguing, complex, and informative. Comorbidity must be a real challenge for diagnosing the disorder. Given the diagnostic criteria and symptoms you've listed here, I can't help but feel that the disorder is really related to obsessive-compulsive disorder. How would you differentiate between the two?
Well, Robert, that's quite a handsome question indeed. The first difference lies in their respective domains in the DSM. In the DSM-4-TR, body dysmorphic disorder is listed as a somatoform disorder, while obsessive-compulsive disorder is listed as an anxiety disorder. Another crucial difference is the degree of delusion that characterizes the disorders. In a study by J.L. Eisen et al. From 2004, which is still the largest study examining the underlying beliefs of both OCD and BDD patients, 39% of 85 subjects with BDD were currently delusional, compared to only 2% of 64 subjects with OCD.
Wow, so even though the two disorders share a variety of symptoms, there seems to be a fairly tangible distinction between the two.
Yes, of course.
Could you take us back to the root here and tell us a little bit about the causes of the disorder?
Certainly. There are a variety of social, neurobiological, and psychological elements that can contribute to the emergence of this disorder. Sometimes it can simply be due to distress caused at an early age after a person's perceived flaw has been noticed and pointed out by a friend or family member. Other times it is more complex. One social factor that is incredibly prominent is the pressure that is created through the media in its portrayals of the perfect image. This can cause young girls and boys alike to seek excessive forms of plastic surgery, or even to take drastic measures of self-medication that could cause serious physical harm. Furthermore, OCD is not the only form of comorbidity underlying body dysmorphic disorder. Various other anxiety disorders, as well as mood disorders and personality disorders, have been associated with BDD. In a study by E. Hollander et al. From 1993, 38% of a group of 50 BDD patients were identified as having comorbidity with personality disorders. At a neurobiological level, several studies have shown that BDD patients tend to have lower levels of the neurotransmitter serotonin. Low levels of this neurotransmitter can lead to depression and many other disorders.
So, with such an inhibiting disorder, how are BDD patients maintained? What do we tend to see in regard to both maintenance and prognosis?
Well, Robert, this disorder is comparatively newer than others, and therefore it is not well studied. According to the DSM-4-TR, the disorder tends to be more continuous, and its symptoms tend to fluctuate in intensity over time. The prognosis is quite uncertain, though there are a variety of treatments, some of which have been quite effective. Sometimes hospitalization is required, which could have either a negative or positive outcome. In addition, certain medications, more specifically selective serotonin reuptake inhibitors like Prozac and Zoloft, have been successful in a number of cases of BDD. However, by far the most successful form of treatment has been cognitive behavioral therapy. This involves admitting to the delusional nature of certain behaviors and restructuring these behaviors in order to overcome them. Relaxation techniques have also been used in this treatment and can be successful. As I said, body dysmorphic disorder is still quite understudied, but with more funding and more attention to the severity of the disorder, I believe we will eventually see its decline within the general population.
Well, thank you very much, Dr. Cunningham. Your information was very insightful, and I believe it has the potential to help many of our own viewers here today. But tell me, are there a lot of terriers in your field of research?
No, I am the only one.